So what is artificial intelligence? Key first question, because not everyone will necessarily know. So AI is a broad term, but the famous American computer scientist and AI pioneer Marvin Minsky explained it as the science of making machines do things that would require intelligence if done by people. So that's still a bit jargony. So let's look at a more specific subfield of AI, which is machine learning. This is often what we're talking about when we say AI. And machine learning is when we teach a computer to solve problems by training it with lots of past examples of the same problem. And we call those past examples training data. So how is AI different to other forms of computer software? Well, a traditional computer program will do exactly what it's been told to do with a clear step-by-step series of actions. So as a really simple example of this, let's take a calculator and tell it to add the numbers 1 to 5 together. It'll perform those sums and will then give you an answer. With AI, we can make more open-ended requests without laying out the steps that the computer needs to follow. The point of training an AI is so that it can work out the best steps for itself. This allows us to ask new questions like, what did that person just say? The AI must work out what sounds in the environment are speech, what those speech sounds mean, and then often create a sensible reply. Another example, more normal life would be, wouldn't it be useful if you could go into a supermarket and check how long the loose fruit and veg might last just by snapping a picture on your phone? And again, there's lots of tasks involved in that. The AI would need to work out what in the image is fruit, what sort of fruit it is, and then by comparing it to past examples, how ripe does it look and therefore how long might it last? So again, lots of tasks involved. Obviously, there's even more to consider with something like a self-driving car. So you'd have to think about weather conditions, other vehicles, pedestrians, and debris in the road. That's why we haven't seen self-driving cars become widely used yet, because the AI technology needs to be very advanced. Ultimately, though, it's still just a computer program which performs a specific function using a complicated maths sum. I think it's important to fairly early on address, well, what are the limitations of AI? So the first thing to say is that AI is not currently at a super intelligent stage. It's not self-aware, it's not inventive, it's not making its own decisions, and it's not going to take over the world like in all the movies. Typically, it's instead focused on doing a very narrow task very well and very quickly. So it's quite unlike the images we might have in our heads of like an all singing, all dancing robot human being. It's a much more focused effort. How good it is at this narrow task, though, is up to the human trainers. Without lots of varied training data, that's those past examples, biases can be introduced. And that's where we've seen those concerning stories of phone face recognition not working so well for people with darker skin tones. That's because the AI hasn't been trained well enough. Like the best human expert, though, AI, even the best AI, will make mistakes. Hopefully only occasionally. Human review is still necessary in many situations. This review is required for legal and safety reasons in most cases, and it almost always is the case that that review is necessary when the impacts are life-changing. This human review is effective because often the things that an AI might find hard, a human might find easier. And what a human struggles with might be very easy for an AI because they just solve problems in those slightly different ways. So where is AI already in use? Where do we already see AI? It's quite literally all around us. It's in our phones, it's in our homes, our cars, and basically everywhere on the internet. One example, Google. Google interprets the words we search for, gives us results based on our searching habits and our location and things like that. A simple example of this, if we search for horses a lot, if we then Google shoes, we might see horseshoes further up the list than someone else would. Another key use is social media. So social media companies will use AI to work out what's popular. what we might want to see, and that's based on what we've liked and what we've engaged with before. We've already talked about speech recognition, but lots of smart home devices like Amazon Alexa and Google Home also do speech recognition and speaker recognition, so that they only respond to your voice. Example of this, I'm assuming, I'm not a parent myself, but I'm assuming that you wouldn't want your kids to be able to order 1 million chocolate bars. So if it could just pick up your voice, that would be very useful. We may have all had those creepy, uncanny ads and pop-ups and things like that from time to time. These advertising agencies typically use what sites you've visited previously and what products you've been interested in to tailor the adverts that they show you. The other sort of big area of society that does use AI is the NHS and healthcare providers. And that will be what I'll be going on through the next slides. But to summarize, you'll see that some of these examples are really helpful, really positive. Others perhaps are a little more mixed or may even be concerning, which is completely normal. But this is why we ought to find out a little bit about AI, all of us should. But to the matter in hand, how is AI used in healthcare? The NHS holds lots of useful information about patients, which AI-powered software can use to improve treatment. This includes things like medical history, previous treatments, all the sorts of things you would want to consider before any diagnosis or procedure. AI has been and continues to be introduced into NHS systems. In fact, it may have already been used in your care without you being aware of it yet. Recent government funding has gone to increase the use of AI in the NHS. This includes to all sorts of companies through the AI in Health and Care Award, and they're working to produce technology in line with NHS needs. Examples of these sorts of technology kind of break down into three areas. You've got administration, diagnosis, and treatment planning. So with administration, an example of this is, depending on where you live, calls that you make to 111 might be powered by AI, or you might have used an AI virtual assistant when booking an appointment. As for diagnosis, AI might interpret image from scans, or help doctors work out the position of organs around a tumour. At least in radiotherapy and radiology, again, it's important to emphasise human review in this sort of clinical context is always required. And then we've got things like treatment planning. And again, that's looking at where radiation should go and what effect that might have on the surrounding organs. And it is the case that cancer care often is suggested as an area where AI does and could have a really significant impact. So again, it's helpful to have an idea about AI when you're having treatment in this sort of area. But down to brass tacks, how does this actually affect care outcomes? There are 4 key areas where AI could really make a real difference. And the first of these is consistent care. So when they're advised by AI, doctors can make decisions that are backed up with many previous examples. The AI has seen far more scans and treatment plans than the doctor ever could in their whole career. So this supports their expertise with a bit of extra breadth. The next sort of area that outcomes can be improved through is through efficiency. And you may have seen the streamlinings in treatment planning that AI provides. We're aware of the importance of getting around to treatment as soon as possible with things like cancer, which is even more relevant at the moment with post-COVID waiting lists, and spare time through this efficiency can be used to improve your care in other ways. As for consistency, some of you may have been in the scenario where 2 doctors might have different opinions, and that can be really quite upsetting. So this should help give them a common point around which to discuss. It also means that your care experience should be more consistent between different hospitals. And then finally, tailored care. Because a lot of your own data is involved in the AI process, care can be better tailored to your unique body. However, with all this said, it's completely natural to be concerned about the use of AI in your care. It's something new and something unusual. Or was perhaps several years ago, it's now much more common. There are three key areas that I've identified through research that patients often are concerned. One of these is data security. That is the collection and use of your personal information with AI. Another is a reduction in patient and doctor interactions, that the AI might take over decision-making or mean that doctors spend less time face-to-face with patients. And then with the concept of bias, there have been a few high-profile examples, like the face recognition one with phones that I mentioned earlier, where people from some communities and groups aren't as well served by certain bits of AI software. You might have other concerns, and we can talk about those in the Q&A. But to address some of these now, when used responsibly, AI only serves an advisory role in clinical decisions. Doctors always review, make the final verdict, and explain it to patients. So there isn't a reduction with patient-doctor interaction, they're still fully involved. As for bias, diverse training data can be hard to get hold of. We do have this issue that we have more information and examples for people belonging to some groups than we do for others. A simple, almost unavoidable example here is that we have much more data for breast cancer in women than we do in men, because that kind of cancer is less common in men, so there are less previous examples. However, this all said, the aim is always to find a model which works well for everyone, using diverse data to the extent that it's available. On a related note, actually, in healthcare, AI's training is always finished before it gets to the clinic. The trained AI software is subject to lots of regulations before being allowed into the hospital, and therefore it can't be easily changed afterwards. Any updates come from the manufacturer, again, according to all these regulations. To shine more of a spotlight on data security, because this is a really important issue for many, many people, the personal data that the NHS have is held safely and lawfully by the NHS. You do have the ability to opt out of data being used in both scenarios beyond your own care, though actually the use of this data in research may be to your benefit if new treatments or approaches are found. Data will only be used outside of your care to help plan and improve health and care services, or to research and develop cures for serious illnesses. Your NHS data can be used for used by health and care staff, hospital researchers, medical companies researching new treatments, university researchers, and medical royal colleges. So all the people who are contributing to the health community. On the other hand, NHS data is never used for marketing or insurance purposes. So as an example of this, a pharmaceutical company who might want to sell their over-the-counter pill, they couldn't use your NHS data to help with that. That would be entirely against protocol, and the NHS wouldn't pass on that data to them. But what's also worth saying here is that we're talking in general about personal information. In fact, collecting extra personal data is not always necessary with AI, because the things that the AI looks at, you would want a doctor to look at too, because it's all important to contribute to planning your health. So now that we've got a broad idea of what and where AI is in the world and in healthcare, I thought it might be helpful to go through the stages of cancer treatment and point out the aspects of care which might involve AI. And it's worth saying that different hospitals use AI to different extents. You'll be hard pressed to find a hospital that doesn't use AI at all at this point, but some may use it more often than others. So chances are that there's something in these timelines that applies to you, but it almost certainly won't all apply to you. So first, let's look at AI in diagnosis. A lot of people discover their condition through processes of screening. So an AI might look at a range of genetic and demographic factors to work out the chances of you getting different cancers, and then call you for screening based on that information. As for scans, some scanners have infrared sensors which help you work out the position of your body, and an AI can use this position to change the angle of the scanner itself to prevent a repeat of the scan. Guaranteed, but it may prevent you having to go through that potentially uncomfortable scanning process again. Then, once that scan's completed, AI can help with an image analysis. It can highlight parts of a scan that look unusual or particularly like a tumour, and that draws the doctor's attention, helping them to focus on areas that are most likely to be cancerous first. Booking may seem fairly mundane and appointments may seem fairly mundane, but we do know that it's really important to get to cancer treatment as soon as possible, and automatically optimized appointments and virtual assistant booking AIs both streamline this process. Moving forward into treatment planning, one key issue with both chemo and radiotherapy is making sure that the organs around and associated with the tumour site are protected as best as they can be. So for radiotherapy, some software can draw around these organs automatically so that we know where the radiation's going and how much dose is going to each organ. This turns a repetitive, several-hour-long task for a doctor into a 20-minute review process. For those having chemotherapy rather than radiotherapy, AI can also predict dose tolerances of chemotherapy drugs for different organs. As for medical history, in either case, the AI can take into account any previous chemo or radiotherapy, as well as other surgeries and other health conditions. A doctor might not have seen your particular combination of conditions before, but with all the previous examples that an AI looks at, it may well have seen information on a similar situation. As for the treatment scheduling, again, similar to booking, it's very important with radiotherapy to ensure that radiation levels in the body stay within safe levels. And same with chemotherapy, that the drugs aren't building up within the body unnecessarily. And AI can perform those complex sums very efficiently. Similarly, medicine orders. This seems like a very quality of life improvement for doctors, but actually ordering doses automatically gives less space for human error. And with certain medicines, they might have an expiry or a particular use window of time, and these doses will be correct and won't expire too early. Finally, let's look at AI in treatment itself. So throughout the treatment process, AI can help with monitoring. It can monitor drug resistances of cancer cells and things like that. It can allow doctors to see if treatments that they are currently giving you are still working or whether they should change course. And then finally, this is a bit cheeky bringing research here, but it is to do with treatment. AI performs all sorts of important roles in research, and many new treatments are becoming available now, which would have taken much longer to come about if it wasn't for AI, and some perhaps wouldn't actually exist at all because their process is so closely tied up in AI. So that brings an end to my timeline and to the formal part of the presentation. We now have time for questions, and I hope you really enjoyed the presentation. Thank you for listening.